If you're building your ABA company and you're tired of guessing, this is for you. We built the EBCBA blueprint to give you real structure, systems, and support without the fluff. Details are in the description.
Welcome to another live stream. We have Sarah Feldman. She is the former owner of a multi-site ABA company. She was able to start it and scale it. And now she's with Headstart Health, and she's helping ABA business owners who are looking for a solution that's an ABA in a box. From what I understand, that's probably a very big oversimplification of what they do. But if I'm a business owner, I'm trying to go start my ABA company and I need some help. Headstart Health looks like a pretty good solution for that. Instead of me continuing to butcher what Headstart Health does, I'm just going to hand it over to Sarah. And so just let us know a little bit more about Headstart.
Hey, awesome. Thanks for having us. So, yeah, that's a great intro, Josh. We'll start there. And really, before we start with what Head Start solves for, let's just talk about why people usually reach out to us. And here at Head Start, I usually speak to BCBAs who are in the middle of some sort of fork in the road. They're burned out and they're trying to decide, do I leave the field? What do I do? And so many of us are facing that same kind of decision. And we see 70% of BCBAs are just reporting really high stress and they're burnt out. And they are saying, I'm tired of the quotas, the paperwork, the admin, and it's all eating into clinical focus. And they're saying, I have no autonomy. All the decisions made by the corporate layers, by clinicians. I used to work for a mom and pop. It was really great. But now I have a boss that's not a BCBA and I have this huge hour quota and I can't work for it anymore. And it's resulting into this really high turnover and decreased quality for all of these families. And it's making kids wait even longer on wait lists, which is really hurting the heartstrings of our BCBAs. And so they come to us and they're at this breaking point and they're like, I am experiencing burnout. And I'm like, is it burnout or is it a loss of control? Is it misalignment? And really, they're not wanting to leave the ABA world because they don't love it, but they're wanting to leave it because they're just not finding a place that aligns with their own personal values and their work expectations. And they're showing up to work every single day and they're in this place that they're like, this is not my personal value anymore. It used to be, and I'm expected to work really hard, but my own personal values do not align with this place. And that's when burnout starts to grow. And we know that from field of ACT. And so that's a niche in ABA that's really helpful to lean on when we start to feel burnt out. But burnout grows when what matters most isn't reflected in what we do daily. And so when quotas and clinical models and staffing models and things like that are dictated by others, our values and our ethics and our care and autonomy, all of that kind of gets sidelines and we really lose ourselves in our jobs and we wonder how did I even get into this field in the first place? And so there's a different way to do ABA on your own terms. And so the antidote to that really isn't leaving the field, but it's taking some control back. And that's without quotas and that's without red tape and that's without having something that's a buffer between you and the families and having the opportunity to really execute on your vision and your own clinical expertise and having the opportunity to have some support to make it look right. And so that's really where ownership and the concept of ownership comes in. And true autonomy can happen with that. And you get to actually make your own decisions and you can align your daily work with your core values. And without ownership, you're always operating in someone else's own system. And with ownership, you can start to decide how ABA is delivered and it's ethically and it's sustainably and it starts to be on your own terms. And so that's where Head Start enters, right? And that's really what's exciting for me because that was my own journey. And that's why I decided to partner with Head Start as a former entrepreneur. And so at Head Start, we support BCBAs to go independent by removing the barriers that keep BCBAs stuck. And so I'm Dr. Sarah Feldman. I am a director here at Headstart of Provider and Engagement, and I'm a 10-year ABA business veteran. I built my own multi-million dollar ABA company here from the ground up with only $300. And I had really gone into the ABA world of entrepreneurship because I felt like I didn't see my own values represented in the field. I had been in other ABA companies before. I had worked in the school system, and it was like, I don't see at all my own personal values. One was parents saying, that's really great, but I don't see my child do those skills at home. So thank you for working on them, but they're not generalizing them. And then the other part is really toxic clinical cultures and no collaboration and no really solid leadership. And I was like, what gives? Is this just like the ABA field? Is this what exists? Is this what it has to be? And so I was like, this is enough. And me and my business partner, we got together one night over lychee martinis and we're like, we're going to make something of our own. We're going to make our own ABA company. And so that's what we did. We started with a cocktail napkin and lychee martinis, and we started as an in-home provider, scaled to 4 different clinics across North Texas. And over the course of 10 years, we scaled it, and then we sold our practice in December of 2024. And really, for us, it was not always the easiest route for us to decide like what decision to do and how to do it. And we went through a ton of different ups and downs in that 10-year period of, are we making the right decision? Do we have the right vendor? Are we doing the right thing? Did I file the right paperwork? We'd been burned a million times. We went through the entire COVID pandemic, really siloed because it was a dog eat dog world during that time. Nobody was going to tell you that this is how you fill out your PP paperwork, or this is how you can do this. And when I got the opportunity to open my playbook up and say, this is how we can do this, and I heard that's what we were doing here at Headstart, I was like, yeah, like we have to make entrepreneurship easier for BCBAs, because being independent as a BCBA is the way of the future. It allows other people to really get connected with clinical quality. It gets them connected directly to parents and affect change in a much quicker way. And that's why I'm so passionate about what we do here at Headstart. And so our values here at Headstart are families first. We exist so BCBAs can focus on what matters most, which is delivering exceptional care to kids and families, really without distraction. We don't want you to have that red tape, that barrier, that buffer, that someone telling you this is what your quota is and things like that. And then true independence. We know that this is your practice. You set the hours, you choose the clients, you build the team, and you grow on your own terms. So if you want a few kids, a lot of kids, a multi-site company, a multi-BCBA company, an in-home company, a clinic model, you're able to do that. And we have the BCBAs to support and that mentorship as well. And then really what's most important here is your success is our mission. So running a practice can be hard, and our job is to make it easier. We work for you so you can do the work that you love. And so you're not asking for employees. We are not employees for you. We work for you at all times behind the scenes. You don't have to manage us. We're here to make sure that you are successful. And so we know that when you thrive, families are going to flourish. And so why do BCBAs actually choose Headstart? From beginning to end, there's a whole host of reasons, but getting started with us, we're able to help you start the startup process with zero out-of-pocket costs, right? So your LLC information, your credentialing with insurance, your business insurance, and everything in between. You can save time and money because Headstart's going to handle it. I remember figuring out, like, am I doing my credentialing paperwork right? Or Did I file my LLC? Do I have the right formation? Am I doing this right? I remember even putting like the wrong NPI number on my credentialing paperwork with Blue Cross Blue Shield, which set me back months that I didn't know. And so when you actually have experts who are handling that, you're able to just go so much faster with that. And then what I love too is BCBAs are at the head of every department here at Head Start. So we are not just another AI tech stack solution. We are not just giving you a product and saying, hey, here, figure it out. I hope you get clients. We're actual BCBAs. We're welcoming you into a community, and we're here to hold your hand throughout your entrepreneurship journey. And so we know that it can be a tough road sometimes to be an entrepreneur. And we're never going to say this is a magic pill and it's going to be wonderful all the time. But we're real BCBAs who have built before, and we can answer questions for every step of that journey. Then you have your practice operations. And so for your clinical and non-clinical softwares and tools, you're going to have everything you need to support and run all of your admin work, right? So you don't have to worry about all those extra things. Do I have all the right data collection software, or your admin software, or different things like that? Those are all taken care of, and we have that for you. But then all of the other little things like networking with your vendors or making sure that all of your authorizations are taken care of, those are all taken care of for you behind the scenes. So you're not staying on hold and dealing with that. And then you have end-to-end support once you launch your business. So at the very beginning, you have a comprehensive ABA business bootcamp, but we don't just stop there. We do all of your client intake, all of your RBT recruitment, and then you have expert billing support and weekly one-on-one mentorship. So let's dive in and talk a little bit more about that. Josh mentioned we're like an ABA business in a box, and he took the words right out of my mouth. So at that very beginning, you get everything you need to launch and grow your own business. It's your LLC and legal setup handled for you with real lawyers. You talk with them. This is your LLC. We own no part of that, right? So you get to walk away with your own LLC, your name, how you need it set up. You walk away with it, and we handle all of the costs for you. Then you have liability, banking, credentialing. All of that is done for you. It's done quickly, and it's done in the right manner. And you don't have to wake up in the middle of the night going, did I fill out that form? I think I actually switched the numbers, which is something I definitely did. And then you have your clinical and your admin software. All of that is handed straight to you. It's curated, and it's made for real BCBAs who build. And then employment documents, handbooks, templates, all of the things that you don't need to reinvent the wheel, but you do want it in more of a template way so that you can pick and choose the things that you need. And then you can go in and add, what are my core values? How do I want to change it? Maybe I want some wording things here. Okay, that's great. That's where I want you to put your emphasis in. But what I don't want you to have to do is sit and wonder, what's the policy in North Carolina for FMLA? Let me get that to you, and we can put that into your handbook for you already. And that's already going to exist there. Then once you get that, you have your whole back office. It's on easy mode. We take care of all of your paperwork. So you have that clinical, non-clinical software, your end-to-end insurance and claims management. We don't get paid unless you get paid. And so what's really nice about that is that we want to make sure that you're paid in a timely manner and a full and accurate manner, and that you have real clear transparency on what's going on with all of your claims. And I think that's really important and different as you're starting to build your company. We really want you to understand like what's going on with all of your claims. And it's important as you're building up like your knowledge base as an ABA business entrepreneur. We will take care of all of your verification of benefits, your authorizations, your management, and your claim submissions too. So you don't have to worry about any of that. And then when you're ready to grow, we have a really great exclusive lending partner that you're able to partner with. So What's great about this lending partner is that you don't have any liens or any credit checks with that. Head Start will help back your growth with that. And so you're not going to have to worry about, is my family on the line or any of that? Or you don't have to go and, which was always really hard, go to the local Chase Bank and say, hey, I'd like to grow. Can I have $5,000? And they say, no, because that's usually the way it goes whenever you're a new entrepreneur. With us, you have a really secure lending partner that's already existing that'll help you with your small growth needs. And then as you start to scale as well. Then we move into client intake and RBT recruitment. And I think this is really one of the areas that sets us apart from a lot of the other places that seem to have similar services. We don't just put you on a website and say, hey, congratulations on your new business. Good luck getting clients. 90% of the clients that all of our owners have are sourced by our Head Start team. We actively source and we look to fill all of our Head Start owners with all of their clients that they look to have on their caseload. We want you to be full. That looks like success for you. That looks like success for us. Remember, your success is our success. And then we are BCBAs. And so we understand too that there's a careful balance between if you have the influx of clients, you also need an influx of RBTs and they have to match. And so 75% of all of the RBTs that are sourced by our RBT recruiters too. So we have an RBT recruitment team that is actively recruiting for you. What's really cool about that is that we will post to all the large job boards. We will go through all of those first round interviews for you. We will make sure that they are real RBTs. We will make sure that they show up to their first round interviews. We will make sure that they are great candidates. And then we will hand deliver them to you for their second round interview. That way you don't get ghosted on your interviews. You're not having to sift through all of these like duds. It's actually great sourced candidates for you so you can work really quickly to decide this person's really great person for my team. They already know the area. They already align with how much I'm willing to offer them for pay and for hours. I just need to ask them a few clinical questions and maybe some core values questions to see if they fit best for my team. And then we've got that clinical community. So we have CEUs that are designed for BCBA owners. That's different than kind of those CEUs that you'll see out just in the regular ABA community. ABA community is full of lots of different CEUs, but these are for BCBA owners. You have mentorship from BCBAs within Head Start for people who have already been there before. We've all built ABA companies. We have supported all different stages and sizes of ABA companies. And then you have a peer network of Head Start business builders who are willing to open up their playbooks and chat with you. I remember going back to COVID days where people were not willing to say, hey, this is how you fill out this form, or this is what you need to do. Building in a silo is really hard. And we want to make sure that we do everything we can to make sure that you are not going independent alone and that you have the support from your community around you. So if you have a question, a concern, even just a worry that comes to mind, the Head Start community is here to really support you and make sure that you're able to have a sounding board at any point in time. And then as you launch your company, you get continued ongoing coaching. And so that ongoing coaching is weekly, and it's on a one-on-one basis where you meet with your provider success manager. You get a real-time dashboard where you look at the data of your company and you're able to see, okay, I'm on track, I'm off track. And these are goals that are derived from you, but they're also derived based on what we know to be successful ABA business analytics. And so we're going to say, okay, this is on track, this is off track. What can you be accountable for? What can we be accountable for? What's nice about this is there's no hiding, right? This is a partnership between Head Start and with you. And so we want to make sure that you're accountable to the future that you've asked for, but then also that we're accountable to the partnership that we've agreed to. And so, as your provider success manager, we're here to receive feedback. And then you're also going to receive some actionable feedback too. We've all worked in the ABA field before. We all understand some real actionable and tactical tips to move forward in the next week so that you can move closer to the different goals and dreams that you have. This is also a really good opportunity for you to say, okay, I have this hope, this dream, this scaling opportunity that I really want to do, or this pain point. Can we work through it? This is also the opportunity where someone will say, hey, I really want to make a clinic. When can we open up a clinic? How much money do I need to be making? How much should I save in order to do this? Am I ready to hire another BCBA? At what point in time? And we can really go through all of the data for that and make sure that you stay on track and you have a really clear roadmap of where you need to go. And then one of the really cool parts of being independent is you get to actually have income that reflects your impact. And so we say double your income. There's a lot of different things that you see out there of, I think, flashy marketing. I'll see lots of different other providers out there who will say, you'll make X amount of money if you go independent, if you start adding some weekend hours, or if you'll start your own company, you may, and it's some huge amount of money. At Headstart, I like to be like really realistic. I've been an entrepreneur before, and I understand the actual numbers and inputs that go into how you make your own salary. And I've really studied the model really closely. So I'm a BCBA and I can be fairly cynical when it comes to finances about that because I know how hard it can be to actually take an income. And so with our model, we see providers who are able to make between $180,000 and $195,000 when they're fully ramped per year with 8 clients and 20 hours blended direct hours per week. And that's with like about a 10% cancellation rate per year. So we're trying to say when we look at that, we want to make sure that it's not based on the perfect year and that we're not basing it on all comprehensive kiddos because that's not real life. That's the thing that we're all trying to get away from. It's usually when we're moving away from more of a big box model. And 8 clients, we're definitely trying our very best to make sure that we are having a manageable caseload. So when we go through the provider model, we look at numbers that are like, what would I actually want to take on? So 8 clients with a blended average of about 20 hours of direct per week with about 10% of a cancellation rate per year lands us around between 180 to 195 per year. So why the range? It really depends on the state you live in and what your payer reimbursement rates are. It always depends too of what kiddos and insurance that you decide to take. Because it's your company, you get to decide what insurances you want to take, how much you want to pay your RBTs, and all of those inputs would affect your actual income there. But this is a good round number for us to jump off of here that we see is a good average at least. And so when you launch with Headstart, you're able to launch so much faster. You can spend so much less at the very beginning. When I say spend less, there's less when it comes with dollars, but there's also less when it comes to just wasted opportunity and time with that. And then you can own so much more, right? So you are owning your entire LLC. You own your clients, you own your RBTs. They all belong to you. They do not belong to Headstart. And I think that's a really important designation. When people say Headstart's a partnership, I think it's really important that like this is your full company. You own all parts of that with that. And you can ramp your company. We're seeing as fast as 6 months whenever you follow all of the guidance in our ABA business bootcamp. And so we have a few just like testimonials from our current providers. So Javier talks about having just a smooth and supported transition. He's one of our newer providers, and he already has, I believe, about 5 clients in the queue. He just launched less than a month ago, which is really exciting for him. And that He has more confidence to be present in the work because we're taking care of a lot of the back office for him. With Tobias, he knew that he wanted a partner when he went into entrepreneurship because he wanted support with the accountability, and that he felt like it turned something that felt impossible into real progress. With Tanisha, she really was looking for something that aligned more with her values. And so before, she was felt like ABA companies were just not aligned with her values. And we've had really long conversations before about this with her. At Head Start, she felt like everybody was really supportive in growing her own company that aligned with her values, and that she's been really supported in launching her practice. And then with Christine, Christine's always just a ray of sunshine, but he said that everybody's been phenomenal through every step of opening her practice. And that really for her, she was just tired of seeing kids be the person who gets the short end of the stick with quality treatment. And that's really what she wanted to focus on with launching her practice there. And so I know we flashed through those a little quick there as well. And so when you start your company with Head Start, it's really very simple. If you book a call, you'll meet with a Head Start team member. That Head Start team member is me. We kind of have a conversation about your vision, your values, what it is that you want to accomplish with your company. And then we go through our provider financial model. We go through all parent numbers. What does it take to ramp? We talk about all the ins and outs of it. I really want to make sure that you know all the numbers that it takes to grow your company. And what does partnership between us look like? What would you expect from us? What expect from you? And then we can decide together whether or not it's the best fit from there. After you move forward with Head Start, then you're able to complete your onboarding and your training. We give you a 60-day boot camp of onboarding, which is exciting because you're able to really have the core business foundations you need to feel successful and equipped. Our job here is to take away as much of your back office strain and paperwork and things like that. But what we don't want to do is ever take away the opportunity to understand all the different core components of what it takes to run your business, because this is your business that we are doing behind the scenes so that you can really process through and so that you have some ability to have oversight over, I really what they're doing, or I need it to be a little different, or this is going well, or this isn't going well. This is your company and you need to have that level of ownership as well. And so when you go through that onboarding and training, that's the first time you're going to get some of that baseline foundation of your training. That's not the last time. And so you'll continue to have ongoing training and support throughout your partnership with Head Start, where you will continue to grow your skills as an ABA business owner, where you'll be able to say, okay, I think I really understand this process of insurance, or I really understand this process of ABA finance and things like that. So you begin to build your confidence, but it's scaffolding. Then after you complete your boot camp and your credentialing, then you're able to start seeing clients. We say usually less than 60 days. Of course, we could just kick you out there, credential you, and say, go fast. You can do it really quick. I see. We could do it in 30 days or less. Absolutely. There are some payers that will credential you that fast. The detriment to that is that you might not get the same level of training and support and know-how in order to be able to be a successful, well-rounded, and confident business owner. And so at Head Start, our job here is to make sure that you have all the training and foundation and support in order to launch your business. And so to that extent, we really want to make sure that you go through all of your training and that you understand it so you can launch with confidence as well. And so if you're interested in more with Head Start, you can connect with us on our website at headstart.health. You can book a call with us on there. And then you can also follow us on Facebook and Instagram for headstart.health, and then on TikTok and on Instagram for BCBAs who build. And if we have any questions, I'm happy to take those as well.
I really like the way that you explain the partnership because we have the same challenge in the IT and cybersecurity space when we're working with not just ABA companies, but companies in general, where somebody, whether there's a regulatory compliance requirement or they have a cousin that's in IT or something like that, and they say you need to get a firewall. Let's hold on, like you don't need just some magic box that sits on the shelf that you don't really know exactly what it's doing for you, other than just like knowing that it's keeping you secure. You don't need to understand how a firewall works, but you do need to understand what it's actually doing for you or whatever it actually is. That way you're not just paying for this service or a product, and it's not this like magic box that's going to give you some secret output that you don't really know what it's actually doing. So I think that's really important, that as much as you can hand off the admin and back office and everything to Head Start Health, you still need to understand it. So I think that's really important. Yeah.
Yeah.
I think this is great.
Yeah, we want to equip our BCBAs as much as possible now and in the future. We think they're building the foundation, but they're going to be a business owners for a long time. And so this is just the very beginning. They're building their foundation. They're going to do these piece of knowledge now, and it's going to plant the seed for future situations and different things that they need to apply it to. So we don't have to rely on going to a Facebook group or going to a Reddit channel or anything like that. We want them to feel like they are fully formed entrepreneurs that can think on their own feet, and that we're not necessarily doing all the thinking for them, but we're equipping them at the same time.
So I know we talked about startups. Is it like, let's say I'm a BCBA, I go start a business and I get into it, and I basically create a chaotic business that I need help with. Would you also be able to help somebody who's already started and already gone through that process?
Yes. Yeah, absolutely. We can help kind of like untangle anything that's, if you've gotten into it, we've spoken to people who have 6 months in, they're like, this is more than I wanted to do. I've spoken to people I've shut down my practice because I didn't want to do that. Absolutely. Whatever phase of business ownership they're in, we can tag along and fit right into that and start to scaffold where their needs are to support them to be successful.
Cool.
Yeah.
All right. Does anybody have any other questions? All right. I appreciate having you on here. And I think we have some scheduled in the future. So stay tuned on the Facebook group. Those are events on the Facebook page. So make sure you get that. If you're watching this live or if you're watching the recording, there are going to be other live streams and recordings with Dr. Sarah Feldman. And I'm looking forward to the other ones. So thanks again, Sarah.
Yeah. Thanks, Josh. Looking forward to it. Bye, guys.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.